Hi, I'm Elisha Dunn-Georgiou, President and CEO of Global Health Council. I joined GHC a little over a year ago, but have been a part of this community for far longer than that. I have had the privilege of being a member as the organization worked to advance global health priorities, and I have always been extremely impressed at the level of impact we have had. I am very proud to be leading GHC as we celebrate our 50th anniversary. Though I am certainly unable to take credit for our entire journey, I am honored to be picking up the baton and continuing our legacy of driving sustainable funding and equitable policies to improve global health and well-being for all. It's an interesting time to be celebrating this milestone. Over the past 5 decades, we've seen incredible progress and innovation in global health. Groundbreaking health programs like the President's Emergency Plan for AIDS Relief, the President's Malaria Initiative, and the Global Fund have only existed for about 20 years. GHC has borne witness to these advancements as they happened. We also witnessed the Millennium Development Goals evolve into the Sustainable Development Goals. We have cheered as maternal and child mortality decreased exponentially throughout the world, and we have advocated for equitable access as new life-saving vaccines and innovative treatments were created, allowing people to survive and to thrive. In many cases, GHC has been at the center of critical advancements in global health. Every year, we also host a diverse delegation of advocates to the World Health Assembly. At the last World Health Assembly prior to COVID-19, we hosted a large delegation of civil society representatives. This past year was, of course, much smaller due to pandemic-related restrictions. However, GHC was on site and presented statements on sustainable financing and human resources for health, among other issues. COVID-19 has unraveled some incredible progress over the past decades. The GHC community has worked to address this novel threat. We pushed global health leaders to respond in a way that was multidisciplinary, holistic, and centered on the safety and security of all people. One way we did this was by helping to secure $20 million in global funding as part of the American Rescue Plan. In addition, we organized community focus groups with grassroots civil society organizations and communities to capture lived experiences and challenges marginalized populations faced during the pandemic. In addition to these efforts, we rolled out our first ever Advocacy in Motion, or AIM, grants to support civil society advocacy, health equity, and to amplify the voices of local and regional organizations. GHC is well positioned for the future, and we are focused on doing what we do best, working across global health sectors to advocate with a collective voice for the greatest impact, providing access to information, resources, and expertise, and amplifying critical global health messages to communicate effectively and persuasively with policymakers. I am so proud of GHC's storied history, and I am excited for what is to come. But most of all, I am grateful for this community and for the continued partnership of each of you. Thank you for your enormous contributions and for working together to safeguard the world against disease and build healthier, more sustainable communities.